We have some question from the audience. One is, what kind of material you're using? Can they stand the test of time?
Those are great questions. Those are still questions that I have as well. So as far as specifically, the materials have graduated from the original Bago, like ceramic type crown resins that could be printed on SLA printers, and now all the way through the latest iterations of Sprint Ray's, majority ceramic content resins, the Sprint Ray crown resins, and they've got new resins coming out that are more 70% ceramic content. Fillers are getting denser, they're getting more polishable and more durable. But I still posture them in this entire new middle ground that has been created by this 3D printing territory. My jury is out as to, are they really final crowns or not? And maybe not, but I'll put them in service. I'll put them in situations where I know what the solution is going to be if and when they do fail. But I do also know now that it's going to be not just 2 months later when they fall apart. It might be 2 to 5 years later. And in that sort of time scale in my head, it's redefining how I approach full mouth overhauls, because now I can break it into segments and I don't have to charge people all the money up front.
Right. And you don't have to wait with like flattened out teeth for a couple of weeks. You can just get it right away with something.
In first day, we can blueprint the entire mouth, get every problem solved, and then the clock starts ticking, and my judgment starts to apply to how durable these things really are. So in the event that one breaks off, in that case, I showed it and didn't have time to get into it, but I've replaced 2 of those now 16 little onlays, if you want to call them, over 2 years. And I just did a traditional crown at that point. But guess what? Doing 1 to 2 crowns a year is exactly what dental insurance pays for.
Yeah. I have experience of that. That's what I was thinking when you're talking about the parallel processing of the entire mouth, which makes sense because people who have the means, but on the other hand, dental insurance don't pay for all the teeth 1 year. You kind of actually have to pace yourself.
No, they pay for 1 to 2 of them, but that's kind of like 5% of the total transaction cost, and the rest of it comes out of pocket.